There's a research program that's funded through the Department of Defense called the Peer Reviewed Medical Research Program, or PRMRP. This program has a list of conditions that are eligible to submit applications for research funding. Because IC had been on this list, valuable research has been funded through the program. I personally have worked with this program as a peer reviewer and got to look at some of the studies that were being proposed for funding. One of the most promising research programs that's been funded through this program is currently going on at the Beaumont Research Institute. Some of you may have participated in this program, which is already on phase 2. The purpose of this phase of the program is to come up with a urine test to determine if a patient has IC, which would mean we no longer have to come to a diagnosis of IC through ruling out everything else that could be possible. To be on this list takes advocating with members of Congress on the Hill, and that is why the ICA is so diligent at bringing this information to members of Congress to get IC on that list and to keep it there.
Now that we've talked about some of the key functions of Congress, I want to touch on some of the key federal agencies that we work with. First, there's the National Institutes of Health, which is the premier research agency in our country. They do a lot of important work on funding critical research, which helps us better understand conditions, which leads to better treatments and better therapies. I'm sure a lot of folks have heard a lot more about NIH over the past year with the COVID pandemic, especially Dr. Fauci, who is the director of one of the institutes. But we primarily work with the National Institute of Diabetes and Digestive and Kidney Diseases, or NIDDK, which houses primary research onto interstitial cystitis. And we also work within NIDDK with the MAPP research network, which is the multidisciplinary approach to the study of chronic pelvic pain. And these three agencies are critically important for us because they're the ones who are able to support that robust level of research. We work to advance key funding priorities to make sure that NIH receives the maximum amount of funding possible, because when they are able to have that increased amount of funding, they're able to support more research into interstitial cystitis, chronic pelvic pain, and any number of other priorities. We also are very fortunate to have a good working relationship with NIH, NIDDK, and the MAPP program.
Interstitial cystitis advocacy takes many forms. One form is to acquire or maintain funding for the interstitial cystitis patients' needs. And what I mean is funding specifically earmarked for research, for educational purposes, and so forth. If we don't keep advocacy going, I don't think the funding sources and advancements in the field will continue. So it's so important to get the word out there. One of the things that I've been involved with for many years has been interstitial cystitis research. One group I've been working with for almost 10 years at this point is the MAPP network. This is an NIH, National Institutes of Health, funded project exclusively to work on the needs of patients who suffer from chronic urological pelvic pain. And as MAPP stands for, the multidisciplinary approaches to the study of chronic pelvic pain, you get the idea that it's not just urologists, it's not just gynecologists, it's a whole group of people, not only clinicians, but basic science researchers, all working in collaboration to ultimately help the lives of patients who are afflicted with interstitial cystitis. Through the years, we've published over 90 peer-reviewed articles, which have really, in my opinion, advanced the field, have sensitized not only the clinical people out there, but also the basic researchers out there, that this is a field that needs more investigation, more work needs to be done. But at the same time, I think that we have uncovered lots of new mechanisms and explored the condition that ultimately will be translated to better patient care. In order to keep this project going, obviously it doesn't come without a cost. We need to acquire these fundings, and we need to knock on the doors of our legislators and their aides to tell them about our needs. Of course, there are other government resources that are available, such as the Department of Defense, the Center for Disease Control, all sorts of other agencies that we need to knock on their doors too, tell our legislators we need to get funding available through these agencies as well.
In addition to our work with the National Institutes of Health, we also work very closely with the CDC, which is the Center for Disease Control and Prevention. And again, I'm sure many of you have heard a lot about CDC over the past year when it comes to guidances with the COVID pandemic and any other public health information. That's the primary focus of CDC. They are the nation's public health agency. They're the ones who share critical information and science with the American public. So on one hand, you have NIH, which does the critical science research of it, but they're not the ones who are sharing the information with the community or with the general public. That's the role that CDC plays. We are very fortunate to have a dedicated program at CDC for interstitial cystitis, and that is the Interstitial Cystitis Education and Awareness Program. We've been very fortunate to have this program in existence over the past many years. We have continued to grow this program's funding to ensure that there is more that we are able to do as an organization on behalf of the IC community, and there is much more that we are looking to do in the future, but CDC has been a critical partner of ours, especially with the work that we've done through the IC Education and Awareness Program.